Presenting in just a few minutes will be Natalie Gruchow. Natalie managed a 6-doctor hospital for 9 years in Fargo, North Dakota, and is a certified veterinary practice manager. She has been a fear-free certified professional since 2017 and led her team to become a fear-free certified practice in 2019. Since then, she's been a contractor on the Fear-Free Speakers Bureau with elite certification status and recently joined the Fear-Free team full-time as a strategic program specialist. In her spare time, she is passionate about raising awareness about leash etiquette with her nonprofit Petiquette and is also a certified pet loss grief support specialist. Tonight's webinar is brought to you by our friends at Elanco. As a thank you for attending, you can use the code Serene20 for 20% off your fear-free veterinary certification membership or renewal. I'll also go ahead and put that code in the chat. For anyone logging in just now, I want to welcome you to Serene Vaccines, the fear-free vaccine experience. Once again, tonight's webinar is RACE approved and certificates will be emailed to all attendees who attend the full presentation. As a reminder, there are 2 options on your Zoom controls, a chat feature as well as a Q&A feature. We'll have time at the end to address questions from the audience, so if you have a question, please use the Q&A box, otherwise it may get lost in the chat. A recording of tonight's presentation will be available for all attendees within 2 weeks. Natalie, we're so excited to have you with us here tonight, so on that note, I'll pass it over to you and we will get started.
Great. Well, thank you so much, Nick, for the introduction. I'm very happy to be here. And I want to give a shout out to all of the vet techs. Happy Vet Tech Week. Yay. Thanks for all you do. Just a quick, boring conflict of interest. I am a consultant with Elanco, an employee of Fear-Free. And a little bit more about me on a personal level. On the left there is my baby boy, Bubbles. He's 7 months old. He's a Champagne Lab. And the black dog next to him is Sally. We just adopted her this weekend. And she is actually his biological grandma. So it's been really, really fun. It was meant to be. I was nervous about the introduction, but we introduced them slow, outside to give them some space to let each other get used to one another. And now they are best friends. It's so cute. And below that is my husband and I. We love going on adventures. We were snorkeling with whale sharks there. We've snorkeled with blue sharks and reef sharks as well. And my nonprofit that Nick mentioned, that is me at a booth at a rescue event. Not all dogs like to say hello, and that's okay. #leash etiquette. And then the photo below is my husband and I and my angel boy Sniff. He was the inspiration behind my nonprofit. After being attacked so many times by off-leash dogs, he just developed a distrust and didn't tolerate an invasion of his personal space. So walking with him became quite scary. He was 90 pounds, and as soon as a dog ran up to us and invaded his bubble, I guess I like bubbles, the word bubble, but anyway, it would be a fight, an immediate fight. So that's why I started raising awareness on leash etiquette. And I'm proud to say that I put on this personal pet bereavement policy talk at a local event in my community of Fargo, North Dakota. It's called Disrupt HR. And the link to this video will be on my website when it's published. But I basically let hundreds of local business leaders know that personal pet bereavement policies belong in every single workplace, and got a great reaction out of it. And hopefully we can make some change with that. So the objectives of tonight's webinar will clearly explain vaccination benefits to pet owners, apply fear-free concepts to safely and comfortably vaccinate patients, and develop skills for successful fear-free communications with your team and clients. Because we know fear-free takes the pet out of petrified, and we can keep vaccines serene. And one of the things that we will learn how to do is to start with why. Why should clients get their pets vaccinated, and anticipate their concerns and emotions that arise from deciding to vaccinate or not. So here is some research articles that I studied I wanted to give you a little snapshot if you enjoy reading the research. Very interesting things. So this is the framework of what we'll be going through today. First study is from Malter et al., and it's the vaccine compliance study. And the objective was to determine non-core or lifestyle vaccination rates of dogs and cats current on their core vaccines as defined by AHA and veterinary practices across the United States. And it's a first of its kind study. It's really, really cool. They took data from November 1st, 2016 to January 1st, 2020. And to qualify for the study, the pets had to be current on their core vaccines and according to their primary care clinic's 1 year or 3 year protocol. And there was a 2-month grace period on that. So with the transactional data from over 1,600 practices across the 48 states, only 41% of cats were current on their core, and only about 50% of dogs were current on their core. And that's kind of shocking and disappointing when you think about the limitations of this study. These are the most compliant clients. These are the pets that are coming in regularly. So these numbers are even more inflated than the general population, since the numbers reported are only from the most compliant clients. And
Hey, Natalie.
yeah.
I'm going to chime in for just a second. It sounds like a few folks are having a hard time viewing the screen. Would you mind just turning share screen off and then turn it back on?
Oh, sure. It looks like that might be a little brighter.
Then thank you everyone for bearing with us. If anyone else is having a hard time viewing the screen, feel free to directly message the panelists.
How is that? Is that a little better?
I'm able to view it, so we're going to continue on from here. And if any other hiccups come up, I will chime in again.
Okay, great. Yeah, thanks for letting me know. And so you might be wondering what is actually a lifestyle or non-core vaccine. So it's really what it kind of sounds like. It's not required by law, and it's largely about the geographical location of the pet and also the lifestyle of the pet owners. So are they traveling together? Are they going outside of their their home base? Are they being exposed to different pathogens and diseases that they normally wouldn't be exposed to? So that is, for example, like the lepto vaccine is a good example of that. See if it'll advance. Oh, there we go. So this is the little graphic about this study. And basically what they found was that some non-core vaccines should be considered core, like the feline leukemia and the lepto vaccine. And 63.2% of cats that should have received the leukemia vaccine didn't. 37% of dogs that should have received lepto didn't. And over 40% of dogs that live in Lyme endemic states did not get Lyme vaccinated. So that is a huge area of opportunity for us as veterinary professionals, how we can strengthen the recommendation of pet owners to get their pets vaccinated. A good piece of news, though, is that of the dogs vaccinated for Lyme, 85.5% also received the lepto vaccine. So that is a good indication of the understanding of the overlap, where Lyme and lepto tend to fall in the same geographical areas. So if we can focus on what we control, such as the veterinarian recommendation, and providing the education to pet owners about why it's important, we should start to see those numbers rise. And some of the reason for this for the lack of compliance rates. Possibly it's the difficulty of risk assessment. Maybe the veterinarians aren't asking the clients that might be traveling, taking their pets with to the lakes area or areas that they might be exposed to these things. And there might be a lack of awareness of expert guidelines or even just the regional disease risk. If people aren't exposed to that type of knowledge and information, they're not going to know that there might be lepto on the ground because of a raccoon or mouse that you know, exposed the environment to that. And moving on to the next study is a human fear of needles. I'm sure I'm not alone in that I'm not a big fan of needles. However, I can control the fear and anxiety and stress in my own self, especially when I am with my dog and he's going to get vaccinated, because we know that pets can sense our anxiety. We can project our own fear of needles and get tense and anxious and afraid while we're waiting for our pet to be vaccinated. And of course, they're going to feel that. They're going to pick up on that. And that alone is going to increase their fear, anxiety, and stress. And the study found that the human fear of needles is more prevalent in females. And when you think about your most common client that are bringing their pets into the clinic, it's generally a lot of times the female owner that is coming in. And what the study said that greater attention should be directed to interventions which alleviate fear in high-risk groups. Well, Fear-Free can do that. We can do that by explaining to clients that we use Elanco combo vaccines, which result in fewer needle pokes. There's lower volume, there's less debris that that cause the vaccine reactions or adverse events. So there's things that we can do to make our clients feel more comfortable with the decision to vaccinate their pet. And this is something that I was very interested in, the vaccine hesitancy of how anti-vax movements possibly influence the rate of vaccinations for our pets at veterinary clinics. So the World Health Organization defines vaccine hesitancy as a delay in acceptance of vaccines despite the availability of vaccine services. So even before COVID in 2019, this was identified as a top 10 global threat. So just think about that for a second, how much has changed since COVID and how much this topic is on the front of people's minds. And the influence of the misinformation that people are getting is definitely causing some negative effects on our pets. And you can think of the range of the acceptance of vaccinations as a continuum, because you have the people that are always going to be 100% against vaccines of any kind for any reason, all the way up to full acceptance, always get vaccinated for every single thing as wherever they can get their hands on a vaccine. And the study results is that, yes, they did find a positive correlation between the anti-vax movements and the number of vaccinated children and families. And that correlates to the concerned veterinary clients as well. And this was another first of its kind study, so it was really interesting. They interviewed Dr. Lori Kogan, and she is a PhD licensed psychologist and professor of clinical sciences at Colorado State University College of Veterinary Medicine. And she said that anecdotal evidence does suggest that human anti-vax movements negatively impact our vaccination rates of our companions at the vet clinic. And so this was a 2021 study. US and Canadian researchers sought out to find this correlation, and I know there's hints of a new study coming out with similar findings, and I think that this is going to be a bigger and bigger topic as we learn new ways of treating disease, new treatments come out, which is great. We're really excited to see the advances in medicine. So what they found was why clients chose not to vaccinate pets. Look at how much of it is things that we could control. Feeling it wasn't necessary, hadn't thought about it. That is all things that we could do better about explaining to clients why it is necessary, why they should think about it. Of course, there are things that are out of our control. The expense, yes, there is an expense involved, and we can't necessarily control that. But if we can be more proactive from the beginning and explain to clients why they should get certain vaccinations, then we are already one step ahead. And another thing too is that it's an emotional decision. The clients that do have a form of vaccine hesitancy, they're feeling that way because of an emotion. Most of the time it's not due to a medical condition that it's actually, medically recommended to not vaccinate. That is usually not the case. Usually it is because of an emotion. So if we can talk to clients about that, use it to your advantage. Let them know that you commend them for showing an interest and a concern in their pet's health, and ask them how would they feel if their pet did contract a preventable disease from a vaccine. And then say, we can talk about the pros and cons of each decision, and we can find a way to get your pet protected against these diseases. And so Elanco vaccines are a really wonderful addition to have in your, for fear-free. They have the combo vaccines, the lower volume and the less debris. And this video is great at explaining that in more detail.
Our pets do so much to make our lives better. So naturally, we want to return the favor, starting with lots of love and the best possible veterinary care. Vaccines are necessary for keeping our pets safe, healthy, and protected from disease. What isn't necessary? Discomfort. That's why we use fear-free handling techniques to administer ultra vaccines by Elanco at our practice. We'll do all we can to make your pet and you as stress-free as possible when you come see us. The thing is, happier wellness visits are possible, especially at veterinary hospitals that use highly purified, half-milliliter ultra vaccines by Elanco. Why? The highly purified ultra vaccine lines were specifically designed for a more comfortable vaccine experience. Using cutting-edge technology, ultra vaccines by Elanco are designed to reduce vaccination reactions associated with unwanted protein and debris. This excites us because excess proteins and debris can cause allergic reactions. But in these revolutionary vaccines, proteins are reduced by up to 75% compared with standard vaccines, and are designed to reduce the risk of swelling or pain at the injection site. The highly purified formula offers effective disease protection with minimal injection volume for a more comfortable vaccine experience. Our team will distract your pet with treats or toys, depending on their preference, when it's time for a quick vaccination. Because ultra vaccines are highly purified with 50% less volume than standard vaccines, they're easier and quicker to administer. Your pet may barely notice anything. Plus, highly purified ultra vaccines come in convenient combinations for fewer needle sticks. While your dog enjoys getting top-notch care and attention from our team, you can rest assured knowing highly purified ultra vaccines are backed by science. Take Leptospirosis, a bacterial disease that dogs can contract by drinking from a contaminated puddle, or even just walking on the street and licking their paws later. Unprotected dogs who contract leptospirosis can develop fever, chills, muscle tenderness, vomiting, or even kidney or liver failure. Up to 1 in 5 dogs that develop clinical signs for leptospirosis will pass away. No one wants that, so we protect our patients with TruCan Ultra L4. In a field trial of 15,000 doses of the leptospirosis vaccine, TruCan Ultra L4, clinics only reported 6 incidences of adverse effects. All Ultra vaccines align with vaccine guidelines and protocols from both the American Animal Hospital Association, AHA, and the American Association of Feline Practitioners, AAFP. Ultimately, happier wellness visits mean happier pets and happier people. And the icing on the pup cake? That same day, back at home, dogs can go back to doing what they do best, being dogs. And don't worry, cats can have happier veterinarian visits too. Unlike dogs, cats aren't vaccinated for leptospirosis. But as you know, they need to be vaccinated against other potentially deadly diseases to keep them as healthy and happy as possible. Luckily, highly purified Ultra vaccines by Elanco are available for both dogs and cats. Here's to happier wellness visits for all our furry friends.
Yeah, and it's vaccines. One of the things that I think is a contributing factor in some of the resistance of vaccines is that you don't necessarily hear about vaccines when they work. When they're working, there's no adverse reactions and the pet is disease-free. But when a pet does have an adverse reaction or contracts a disease, which is incredibly rare, that's when you hear about it, and that's what people latch onto. And when you think about the rabies vaccine, that is much more widely accepted, and a lot of it has to do with education. It's the thing that we can control. It's letting people know what getting rabies looks like. It's awful. The treatments are awful. So if we can increase our do better with explaining to clients why they should vaccinate their pets against these preventable diseases, it's just so important. Let's see, trying to advance. Doesn't want to advance.
Our pets.
Oops. There we go. So Serene vaccine, how can you introduce the Serene vaccine experience into your practices? Well, the first thing is that the fear-free experience does begin prior to arrival. So what that looks like is making sure the clients keep their carriers out all the time, so that way the pets are used to it. We want to avoid a situation where the carrier only comes out once a year for their wellness visit, and it's just this big ordeal, and increase the FAS immediately just by bringing out that carrier. It also means getting the car to room temperature. If you think about our extreme environments, sometimes it's 100 degrees plus, sometimes it's minus 50. And if we're taking our pets that live at home, don't hardly ever go out, if we take them and put them in a car that is the same temperature as the outdoors, that can also increase the fear, anxiety, and stress. So if we can try to warm up the car or turn it on, run the AC for a little bit to get it closer to room temperature, that can really help a lot. It's also the car ride to the clinic. Road rage. Road rage is going to increase your pet's fear, anxiety, and stress. So don't be shaking your fist and saying explicitives that your pet doesn't know why you're angry. They think that you're yelling at them. So keeping a calm presence will help. And also it's the music that you play in your car as well. Classical music and even reggae have been scientifically proven to have a positive calming effect on our pets. And the reduction of fear actually, it may diminish the pain. So PVP is really important to prescribe the PVPs, like the pre-visit pharmaceuticals like gabapentin, trazodone. Pain-related anxiety increases perceived pain intensity. So if we can keep that anxiety lower, we actually set the pet up for a more successful vaccination experience by reducing their pain. And then pheromones. Pheromones are so important. Feel Away for cats, Thunder Ease for dogs, formerly known as Adaptil. We would use pheromones everywhere in our clinic. At check-in, cats would get a Feel Away coated towel. Dogs would get it was an Adaptil treated bandana. Let clients know that they can purchase these pheromones for use at home. We would even make some fear-free bags that would have a small little sample of pheromone in a little like perfume vial that you can get on Amazon. You can get like 200 of them for like $20 or something. And so what we would do is we would take the big size bottles of the pheromone and then just make little spray bottles, and then get the little stickers, the Avery stickers, labels, and just put the instructions on there, slap them on, let clients pick those up for free so they can set their pet up for a fear-free veterinary visit. Gentle control, considered approach, touch gradient. These are all core concepts for a fear-free approach. Gentle control is stabilizing the pet. We don't think of restraint. We don't think of restraining pets. We think of how can we stabilize this pet to make them feel secure and also keep our staff safe as well. So with this example is a great example of a gentle control and considered approach. By being down on the pet's level, all Christine has to do is feed Pickle a treat, and she's stabilizing Pickle's head on the other side. So that way Amanda can administer the vaccine. No need for heavy restraint here. Treats, and more treats. So that is the ticket. And then the touch gradient is also really important to practice and get familiar and comfortable with that. It's not just reaching for the paw. It's not just, poking the pet. It's desensitizing the area. It's starting at the least sensitive spot, such as like the shoulder, and working your way down, providing constant touch, constant pressure. Try to avoid multiple touches as much as possible. And in a little bit, I'll show you a video where a real example of my previous team at Animal Health Clinic in the trenches giving a couple fear-free vaccine experiences. And then identifying wants versus needs is incredibly important. If a dog or cat is coming in for a wellness exam, blood draw, nail trim, all those things, you would want to do the nail trim at the very end, because that way if their fear, anxiety, and stress increases too much and they become too fearful, well, guess what? That nail trim is most likely a want and not a medical need. We want to get the medical needs done first. So that is really important. It's really important to communicate to your clients about that as well. You want to make sure they understand that you're going to, they might want the nail trim done right away because, scratching and things like that, but we need to give the vaccines that are due. Here's some tips from Dr. Marty Becker himself. He says to get a grip. All animals have an innate fear of falling. So make sure you have non-slip surfaces available for pets, maybe a blanket, a yoga mat, a pet vet mat, anything that you can use to prevent the slippery surface. If you live in the Midwest like me, or you have a snowy ice storm, how scary is it to be walking on that slippery surface? You're always afraid of falling. Same thing for pets. And hello, I'm here. Make sure the pets know you're around. There's a lot of stimulation. There's a lot of things going on. If they don't know that you're behind them, you can easily startle them. So just make sure that they realize that you're around, to avoid that startle. And the playing hide and seek, that is about the syringe. You don't want to make a spectacle of the syringe. You want to try to hide it if you can. Maybe tuck it in your hand. You can drape a towel over it. You just want to try to avoid that pet focusing in on that and what is that scary thing. Cheap trick. So not only is it an AHA standard and also a fear-free certified practice standard to not reuse needles, but the more needles are reused, the duller they become. And the duller a needle is, the more it's going to hurt. So 25 to 27 gauge needles are very common in fear-free certified practices. And yeah, you don't want to autoclave and reuse needles. And then size matters. Like I said, the 25 to 27 gauge needles are a good option. Of course, the bigger the needle is, the more it's going to hurt. And then go slow with the flow. So the more liquid is in the syringe and the faster you plunge it, the more that subcutaneous tissue is going to tear and the more it's going to hurt. So 3 to 5 seconds is a good rule of thumb for 1 ml syringes. So with ultra vaccines, with Elanco, you can do that in half the time and still maintain a comfortable vaccine experience. You're dead to me. So what that is use numbing cream. We use lidocaine cream. Try to use it all the time, even before the pet is displays some of that fear response. If you can eliminate that fear response because the injection site isn't as painful, you're going to set that pet up for more success in the future. Distraction techniques, really easy to do. If you have a staff member that can hold a peanut butter cup or a toy, anything that you can do to just distract the pet, to get their mind off of everything going on, they're going to focus on that treat. And then the touch gradient that we had talked about already. And beginning with the end in mind, you want to always end on a positive note. Once when that vaccine is done, give treats. Make sure that the pet is leaving with something happy that they can remember with. So here's the tips from the trenches, my team that I miss, but they're still doing great things. So I'm excited to have them share with you from the experts here.
So with vaccinations in the clinic, the key really is distraction. And so we can either use food for distraction. Sometimes we'll do a lot of petting or some scratching and then desensitizing the area before you give the vaccine. We always have high value treats. So sometimes if they really like the crunchy liver treats, we'll use that. Sometimes what works even better is something that they can lick. So with dogs or cats, dogs, a lot of times peanut butter, cheese, smeared on like a lick mat or even like on the table because they don't move as much as when they're eating crunchy treats. So lick things work a little bit better sometimes. Cats, we have like churros and cheese, canned food, anything like that that they really like. The person who's going to inject it, they'll rub the area, scratch it, and then it helps to kind of like poke a little bit. before you do it, and then you give the injection as well. If they're too wiggly, if they react to it, we'll try to find something that's higher value. Or if it's something like a Bordetella vaccine, sometimes we will switch forms. So we have an intranasal oral form. So sometimes that will work a little bit better. Try lidocaine cream as well. And if none of those things work, then we will stop what we're doing, and then we discuss doing a PVP and having them come back in at a different time to try it again. And sometimes if they're here for a whole exam and vaccines and blood draw and also, like other things, it just gets to be a lot for them. So sometimes if they come in for just the vaccine, they can come in, they'll be excited, we can get them excited about treats, and we can distract them enough to give the vaccine.
And another thing, a good tip is marshmallows. Mini marshmallows for pets with allergies can be a great treat for them. And also frozen broth for surgery pets. We can use frozen frozen broth. And then here is,
so with vaccinations in the clinic, the key really,
here's the last video to show. So Mr. Diggs came in specifically for a Bordetella vaccine.
Injectable, since he is so nervous.
The first attempt was an injectable, and the second attempt is the oral. Because he came in for a wellness visit, and we tried to do the vaccine. He just wasn't having it. We were like, okay, we'll come back a different day, and we'll try the Bordetella in a couple weeks. So now, attempt number 3, we called Erica over to just try to distract a little bit, create different stimulation. And you can see how Danielle is hiding the syringe in her hand.
Oh, what a good job. You didn't even notice that I did it.
And he didn't even notice. So that is all I have for you today. Thank you so much for taking time out of your busy days to watch this presentation. And again, happy Vet Tech Week. I appreciate all of you and everything you do to save our wonderful companions.
Thank you so much, Natalie, for that wonderful presentation. We do have time for just a few questions from the audience. I did see a question about combination vaccines. This is my bad. I accidentally dismissed it. I am going to go ahead and leave a link to Elanco's website in the chat. You can take a look there to get more information on any vaccines you're wondering about. This first question is from Lauren. She is asking, from a client education standpoint, other than relaying the numbers or studies of vaccine safety, do you have any other recommendations for discussing do you have any other recommendations for talking points when dealing with clients who have that anti-vax mentality?
Yeah, so I would say, again, starting with why. Why do you feel that way? And then just kind of, fact find and try to get to the bottom of it. Maybe it's actually coming from their spouse. Maybe it's their spouse that is saying no, and they're not wanting their pet vaccinated, or maybe their pet had previously a vaccine reaction and they are afraid of that happening again. Just finding out more details about the reason why they are hesitant would be the first step, and then just address it from there.
Great, thank you so much. This next question is just asking about clarification regarding that numbing cream. How long do you usually wait before doing an injection? Or between applying the cream and doing the injection?
Yeah, so just like 3 to 5 minutes. So if you can just apply it right away and the, when the pet is roomed, even, you can just apply it right away. So that way, it has time to set and start working. But yeah, it really doesn't take long. Doesn't take long at all.
Makes sense. Thank you.
Mhm.
And then this next question is, do you have any recommendations for how you would address an owner who's concerned about over vaccination?
Yeah, and again, I think it's just would be, well, what does over vaccination look like to you? Like that is a subjective type of opinion. So getting into, what that looks like, and that can also play into the lifestyle vaccines too, maybe a pet that really literally never leaves the house, maybe doesn't need a lepto vaccine, for example. But it's all about just being on the same page. Communication is key. Just being able to be transparent and provide factual information is a good first step.
Absolutely, makes sense. It looks like that is about it for questions. So I am going to go ahead and wrap us up here for the evening. I wanted to once again say thank you to Natalie for that wonderful presentation, and thank you to our friends at Elanco for making tonight's presentation possible. As a thank you for attending, everyone in the audience will be able to use the code Serene20 for 20% off your fear-free veterinary certification membership or renewal. And then once again, thank you everyone for joining our webinar tonight. Please be sure to follow us on our social media at Fear Free Pets, and you can also subscribe to our newsletter at fearfreepets.com for invitations to future presentations. We hope you all have a wonderful evening, and we look forward to seeing you next time.
Bye. Thank you.
Thank you.